Hi friends, it's Dr. Ladda here, and in last video we talked about the external features of brainstem. Now we are going to proceed with the internal features of the brainstem. Again, remember the previous figure, that figure which shows which are the nerves, nuclei having relation with particular part of the brainstem. As we know, brainstem is divided into three parts. Upper one is midbrain, middle one is bones, and lower one is medulla oblongata. Now this upper one, that is midbrain, it concerned with two nuclei, that is third cranial nerve nuclei and fourth cranial nerve nuclei, means oculomotor and trochlear. These are two nerves which are taking origin from midbrain. But natural, if I am cutting the midbrain in this way, that is transection, means I am dividing the midbrain into two parts. Now the figures are 3 and 4. Now put 3 at the upper part of the midbrain and 4 at the lower part of the midbrain. Now this will help when you are going to describe the transections. One more thing, the fibers which are taking origin from the cerebrum, the fibers, as we know, the brainstem, your midbrain, a part of brainstem, midbrain, it is just below the cerebrum, a big brain, it is just below the cerebrum. So the fibers which are taking origin from the cerebrum, they are supposed to pass through the brainstem, and if they are passing through the brainstem consists of these three parts, midbrain, bones and medulla oblongata, but natural, they are supposed to pass through all these three parts. Now this is one more funda to remember. The fibers which are taking from the higher center, they are supposed to pass through the midbrain, the bones, the medulla oblongata. This is one thing. First thing is the nuclei which are concerned with particular part of the brainstem. Second thing, the fibers which are descending down, those are called as descending tracts, which are taking origin from higher center. They are supposed to pass through the brainstem, means they are supposed to pass through all three parts of the brainstem. And lastly, the fibers which are ascending up, which are coming through the spinal cord, and they are also passing through the brainstem so that they can reach their destination. They can reach their target. So these fibers, the ascending fibers, the descending fibers, and the nuclei its own, which are the composition or consist of the brainstem, they are taking part. All these and these things are, we can see. These things we can see when we are cutting the brainstem, when we are cutting midbrain, when we are cutting bones, and when we are. For the sake of convenience, midbrain is divided into two parts. One is upper part and one is lower part. Just in the last video, we talked that at the posterior aspect of the brainstem, while we are talking about the external features, at the posterior aspect there are 4 rounded structures, and those are called as colliculi. Single one is colliculus. So those are called as colliculi. The upper 2 rounded portions are called as superior colliculi, whereas the lower 2 are called as inferior colliculi. Now these superior colliculi and inferior colliculi, they are concerned with hearing and vision. So these if I am cutting here, superior colliculi remains at the upper portion, and inferior means transection of midbrain at the level of superior colliculi, one transection, and transection at the level of inferior colliculi, another transection. Again 3 for superior colliculus, means the nucleus for the oculomotor nerve is at the level of superior colliculus, and the nucleus for the trochlear nerve is at the level of inferior colliculus. So just we are discussing and we are getting the points. So the fibers which are coming from the higher center, from where the fibers are coming? cerebrum. Cerebrum has cortex and medulla. Cerebrum has cortex and medulla. Medulla means middle portion and cortex means outer part. The fibers which are taking origin from cortex, those are cortico. Those are cortico. Now where they are going? Where they are going? To the spine. So the name of the tract is cortico-spinal tract. Cortico-spinal tract. Now the fibers are taking origin from B part, so they are scattered. They are scattered, and you can find the fibers there in the midbrain. Now again, if I am proceeding with the transection of the midbrain, good many things are common at the superior colliculus and at the inferior colliculus. At the superior colliculus, you are getting nuclei of third cranial nerve. At the inferior colliculus, you are getting nuclei of fourth cranial nerve. These fibers, corticospinal fibers, are same fibers. Same fibers. One more thing. Now this midbrain, just in the last video again, if you are remembering, we talked that there is something crushed. There is something crushed cerebri. Crushed cerebri. And for remembering, we just use that technique or idea that the cerebrum is crushed. That leads to cause crushed cerebri. So when we are thinking about the midbrain transection, you are getting 4 points. One is tectum. Second one is tegmentum. Third one is substantia nigra. And fourth one is crushed cerebri. So these are the internal structures of the midbrain. Now if there is superior colliculus, there is need of some brachii. Do you know this is brachial plexus and this one? So these type of structures, they are there. Those are called as brachii. Those are called as brachii, which are having relation with the colliculi. So this is the transection of midbrain at the upper level, and just change the nuclei, put the nuclei of fourth cranial nerve there, and you will finish with the transection of at the lower level. If you are again looking carefully, now the fibers which are coming from the cortex, and take it easy. Don't bother. Take it easy. You are a lay person. You are just listening the story of any of the cinema picture. So don't bother and don't get worried about all these things. The fibers which are coming from the cortex, they are supposed to go to the spinal cord. Those are called as cortico-spinal fibers or cortico-spinal tract. Now these fibers, they are coming down at the lower level. Means at the lower part of the medulla oblongata, these fibers, they get crossed. In the same sense, the fibers which are coming up from the spinal cord and which are supposed to go to the higher center, that means cerebrum and cerebellum, those fibers are supposed to reach up, and in the medulla oblongata again those fibers are getting crossed. Which fibers are getting crossed? Sensory. So what could be the name of that decussation? Sensory decussation. That is the sensory decussation. Now the middle part, that is pons. As we are knowing, pons get wider at the periphery. Yes, that external features needs to wider and with the middle cerebellar, pedicle and all this. This wider portion of the pons, that is base, basilar part. What is base? The portion which is toward this side. Because if I am putting the brainstem in this way, as we know, brainstem is not like this. It is not upright straight. It is oblique. And if I am putting the brainstem in this oblique direction, this is the base and this is the upper part. Now this base is broad, and the fibers which are coming from the cortex, they are supposed to remain in the scattered manner with the base. With the base. Again, for the pons, we are knowing the nuclei of 5th cranial nerve, 6th cranial nerve, 7th cranial nerve, 8th cranial nerve. So you are supposed to put the nuclei there, and we are one thing knowing in the last video about the natak and acting of your facial nerve. I think so you remember me. No. मुझे ऐसे ही जाना है, like this or this. So this is a nuclei for 6th nerve. This one is a nuclei for 7th nerve. Now, if you are looking carefully, the 6th nerve is running down straight forward. No natak, nothing. But the facial, it is showing its own natak. Now, if it is running down, why facial is not? It can run in this way, no? It is taking turn round the nuclear abduction. That is creating own impression. So these are the minute findings and things one can remember to put the transactions of the brainstem in proper way. Now, your role is to observe the diagrams from the book about all the transactions. Get the images in your mind. Try to recollect again and again. And with this exertion, you will be ready with 60 to 70% knowledge. Now, one thing you may feel difficult to draw the diagrams. I know, because things are looking different. Oh, this transaction, it is looking new, and this one is how many complications. No, don't worry. The diagrams, funny diagrams, will help you to complete your task of the diagrams, and also help to forget the fear of drawing the diagrams and figures. It will be explained in next video. Thank you. Please don't forget to subscribe my channel for more and more interesting anatomy.